bull MOT is covering the basics that the bull needs to be able to go out and successfully breed. So you start off with a general exam, eyes, checking that they can see what they're doing, teeth, making sure that they can fuel themselves throughout sort of breeding season, and then also any signs of lameness. That's sort of your basic first checks. After that, you then look into more the fertility side of it. So you're having a feel of testicles, measuring testicles, making sure that there's no issues within the testicles when you're palpating them. We then move into actually testing the semen. So that usually involves getting a sample from the bull with an electroejaculator probe, and then we'll actually have a look at the semen under a microscope, make sure it's moving as it should be, make sure we can't see any abnormalities with how the sperm cells actually look. And that's all geared towards making sure that the sperm cells can actually go and fertilise an egg. So you're very much from making sure the bull can do its job to is the semen healthy.
So actually very few bulls are truly infertile. We think it's about 5 to 10%. The biggest risk of not testing bulls is actually subfertility. So subfertility is the ability of a bull to go out and breed 40 females in a time efficient manner. And we think about anywhere between 20 to 40% of bulls are actually subfertile. So it's better to have checks ahead of time, ahead of that breeding season, to give options of appropriate solutions to deal with that subfertility and mean that we're maximising the number of calves that are produced on farm.
Your standard diseases that you're screening for, they're the big ones. Examples would be the likes of Yonis, and that can be a common one that you'd want a bull tested for before he comes in. BVD, generally most bulls will have a status for BVD anyway, but obviously it's something that you need to know about. And then other ones that affect fertility would be the likes of leptospirosis, neospora, these sorts of conditions. So general blood testing before bulls come onto your farm are important, and a lot of the time bulls will be pre-tested anyway, but you also need to do your due diligence.
There is always a risk with a proven bull of Campylobacter, which is a true venereal disease of the bull. It lives in the crypts alongside the penis. So any bull that is proven and has served cows before is always a risk. So it's worth considering in your business plan. Is that worth a risk worth taking? And actually, should you be purchasing virgin bulls? So the spermatic cycle is about 6 to 8 weeks. And one of the major reasons for bulls failing is actually lameness and foot health. So we want to try and test bulls at a bull breeding soundness exam, ideally 6 to 8 weeks ahead of that breeding window. One, that gives us a chance to react to that semen quality and maybe give that chance for a bull to recover if necessary, or if it requires treatment for foot trim, it allows you to get the foot trimmer out and then some subsequent recovery time there. So yeah, ideally 6 to 8 weeks is an ideal time frame to test bulls prior breeding.
Your bull is half of what's going into your calf crop, so don't underestimate the importance of a bull and a healthy bull that's functioning as it should. Semen test the bull if you're not doing it already.